we have AP glide, PA glide, ulnar glide, radial glide. AP glide means antero-posterior glide, then PA glide means postero-anterior glide, then ulnar glide and radial glide. Which one is ulna? This one is ulna. This one is radius. Okay. This one is anterior. This one is this one is posterior. This one is anterior. This one is posterior. You have to hold. See, this is the joint line. Wrist joint is comprised of the lower end of ulna, lower end of radius, the first row of carpals, roughly speaking, not exactly, along with fibrocartilaginous disc also. Okay. So that is the joint line. Okay, you understand that. You move that and you will find that joint line. And you have to get your resting hand. This is supporting hand. This is moving hand, like this. So this is the joint line. Actually, we have to keep our both the hands, supporting hand as well as the mobilizing hand, very close to the joint line. Suppose this is the joint line, okay, and this is the proximal articulating surface. This is the distal articulating surface. You have to keep very, how far it is closer to you, that much it is better. This is the joint line. You have to keep very, very closer, whichever the possible closer you have to keep. I am going to place my arms here and here. Okay, so this is the joint line here, right? So I am going to place my supporting hand here. See, this is the joint line. So it is very close, almost like it is merging with the joint line. I am very close. And here also I am mobilizing the hands. That is also very close here. Can you look at this? Right? It is very close. Actually, what I am going to do is, this is the joint line. If I hold it firmly with the supporting hand, I am going to distract now. Can you feel? Distraction, can you feel? For example, 10 seconds, I'll hold like this. Afterward, I'll release. Suppose I want to mobilize anteriorly. That means I'm going to mobilize my hands like this. Can you feel? This is PA glide, postero-anterior glide. Now, without changing anything, the same thing, same stabilizing hand, same mobilizing hand. I'm going to mobilize posteriorly. Can you feel? Right? Now it will glide posteriorly. Suppose if you want to change, the other hand, or else the supporting hands, if you want to change, you can go like this also. Same way. Same way. Suppose if I am going for ulnar deviation or lateral deviation, I can hold it like this. I am going to mobilize the hand towards radial side. So I am holding like this. Can you see? Always you keep your hands in opposite directions. Supporting hand and mobilizing hands in opposite direction. One way like this, one way like this. Mobilizing. Always for some joints it will be like this, opposite. Or else like this. Okay. So I am going to mobilize from ulnar direction to the radial direction. This is the ulnar direction, this is radial direction. So joint line, I am keeping very close, right? Relax your hands, right? Right? This is radial deviation. Okay, and now I am going to move towards ulnar side, ulnar deviation. Ulnar deviation I cannot do like this because the mobilizing hands should move it like this. So I am going to change my mobilizing hands and stabilizing hands like this. Now I am going to mobilize like this. So I am going to use this hand as mobilizing hands. Can you see? Can you feel the difference now? Now it is moving in this direction. Suppose what will happen? I am not changing my hands like this. Suppose what will happen? This is this is radial deviation. Suppose I am not going to change it. I am going to fix this. I am going to change this hand as stabilizing hand and I am going to use this hand as mobilizing hand. Of course, that will go for ulnar deviation. But the point is, here hand will go to the radial deviation, but the forearm will move towards the ulnar side. So that's not right. Right? Got my point? This is ulnar deviation and this is radial deviation. And the mobilization right, In the grade 1, you should feel like this. You will not see any movements from outside. When you are watching, when some spectator is watching, you will not feel any movement here like this. I'll go inside. Actually, initially we will be having skin, superficial fascia and deep fascia and some other muscle components. Fat will be there. We have to